Hi everyone, this is Farah and I'm here at the Health 2.0 Conference Dubai, and I have here with me Miss Firaoli. Welcome.
Thank you.
Can you please introduce yourself and your organization?
My name is Firaoli Adam. I am a respiratory therapist and co-founder of Mawadda. I've been working with my partner Yasmin, started business about 2 years ago, and we launched last November our hygienic hijab. It is basically disposable isolation hijab for healthcare workers and patients to make sure hospitals are they are including every member that is working part of the hospitals and also patients, making sure we're not spreading any infection, and that to let them know we are also part of the community and to bring a difference to the hospitals we work at.
So I'd like to congratulate you for winning the Outstanding Organization Award. That is incredible. How do you feel about that?
Well, it feels great. We've been working really hard for the past 2 years. So, having being recognized for what we do, this is definitely something that's bigger than us. It's for the future generation, it's for our community and everybody else that been struggling with, not having the disposable isolation hijab available to them in the hospital settings. So knowing that this is being recognized, what we're working on, is a great honor.
So can you tell us what inspired you exactly to go ahead with this idea?
Yeah, definitely. So as a respiratory therapist, we work in different part of hospitals, anywhere from floors to ICU, OR. We're everywhere, basically. So knowing that as a hijabi, when we go to OR room, we have to make sure we wear any sterile what do you call it, scrubs, and sometimes also you wear a hat, and you wear gloves, and make sure you're not spreading any infection, and make sure everything is sterile the way it was supposed to be. So knowing that, going in OR, we just feel so uncomfortable, making sure that we don't impede our patient safety, and is always being cautious about it, and also go into isolations room when we have to go see our patients. But with COVID, it became where everywhere is isolation. As everybody knows, we had to make sure we are covered and make sure that everything, we have our gloves on, our mask, we have our gown and shoe cover, and when we go in to take care of the patient, but when we get out and take everything out, as a person that wears the hijab going to patient's room, we always have the same hijab on for 12.5-hour shift, and it's just something that is like, oh my god, what do we do right now? So we try to put a temporary bandage where we bring extra hijabs. We talk to our management saying, hey, please don't put me there. I don't want to go to a NICU or a patient that doesn't have COVID and kind of spread that infection. So while we are still working as a frontline workers and we went to different states, we saw that some of the hospital provided beard cover. And we're just like, oh my God, they even have beard cover. Like, why could we have something for our hijab?
Yeah,
right? So we're just like, oh my God, okay, let's look into it, see somebody has to do something about it. And we looked it up, we couldn't find much about it, but there was a story out there of people saying similar thing where we were, in OR, that they needed this, they want to make sure that they have this, but then nothing was out there for us to purchase. So at that moment, we just decided, how about we make this for ourselves? We make sure the next generation doesn't go through what we're going through. We want to make sure this is available. I mean, it was a long road, but at the same time, it was much needed. We took some time off from work and worked on it, make sure we register. We went through FDA. We found manufacturer in New York, USA. So we were working on that for 1.5 years before we launched. So we are very grateful for that. It was our story and our need that got us into, making this hygienic hijab. We're trying to scale now, looking for investors and see how we can, bring more products to the system and make a difference. And, this is be a great opportunity for hospitals to have, patient satisfaction, diversity and inclusion, and also stop spreading infections. So hopefully this is something that we will see at more hospitals, as we already are working with a couple hospitals in back in US, and also there is about 13 hospitals that's in trial, looking into this. So yeah, the future is looking like more work, but nevertheless, it was a great work.
That must have been very challenging and very risky too, to like hijabis themselves and the people around them. And I love that you saw a problem and you came up with a solution for it that probably saved you a lot of, risk, and also to your coworkers and everyone else as well.
Yeah.
So that's very incredible. It's very
Thank
inspiring.
you. Yeah, definitely. We didn't want to bring that also back to, our family. We want to make sure we are doing what we want to do and help people, but not put our families at risk, not put the next patient at risk. So definitely came from a problem. This was not something that we thought about going into, because we have a healthcare background, not business background. But, when you have a need and, the community needs you and they're stand behind you, is a motivation that we need, and is definitely for the next generation. We don't want this to continue. We want them to work on something different and come out with more great ideas and make difference in this world.
That's amazing. Best of luck for all your future endeavors.
Thank you, dear.
And finally, I'd like to ask you about your experience at the conference so far. Were you able to network with people?
Yes, we met a lot of great people here from different backgrounds, learn, from every speaker. It was really amazing, hearing their story, how, they also came about and what they're working on. So the future is definitely looking brighter and full of all these people that are it's been amazing. We met a couple of different people, even in our group, the whole healthcare system from different background was here, so it's definitely a great opportunity to learn from them and network from them, and hopefully we were thinking we'll stay in touch and see where everybody went from on. So it's a great opportunity. Thank you so much.
Of course, yeah, we're so happy to know that this has been a good experience for you. That's brilliant. And finally, if anyone would like to reach out to you for collaboration or advice, or to learn more about the services that you provide,
yeah,
where can
definitely.
they find you?
So we have our website up. So even though we're working directly with the hospitals, there was a lot of healthcare workers that reached out to us saying, hey, can we buy this online? We want to make sure we have it. We can't just wait on the hospitals because, the process take a longer time. So we have our website, www.usmawadda.com, and we're also very active on Instagram at us.mawadda. So that is MAWADDA. We also, they can reach out to us. Our email is info@usmawadda.com.
Perfect. Thank you so much, and congratulations again.
Thank you.